Living healthy with COPD. Common symptoms. The American Lung Association reports that COPD symptoms are often ignored in their early stages because people believe that trouble breathing goes hand in hand with aging. However, this organization also stresses that early detection of COPD is key to successful treatment, so it urges anyone experiencing breathing-related symptoms to consult with their healthline practitioners before they can become even more severe. Some of the most common symptoms to watch for include chronic cough, shortness of breath, wheezing, repeat respiratory infections, blue lips and/or fingernail beds, fatigue, and increased mucus. Common symptoms. Production Medicine Net further explains that as the disease progresses, the symptoms do too. For instance, you may notice that you run out of breath faster when walking up a couple stairs than you did a year ago, or that your extremities are beginning to swell. With regard to your breathing specifically, wheezing may also become more present with even minimal exertion. It's also possible that you'll hear a crackling in the lungs when breathing in or notice the appearance of louder breath sounds. COPD flare-ups and exacerbations. While COPD is a physical disease affecting the lungs, research has discovered that this particular condition can affect a person psychologically as well. One study found that individuals with this disease have higher rates of depression and anxiety than those who don't have this lung-based disease. It even suggests that these rates are higher for those with COPD than for individuals with some other type of chronic disease. This research also found that female COPD patients tend to be affected the most psychologically. Additionally, if the disease has a higher severity, then the risk of anxiety and depression is higher too. Other potential risk factors identified in this study include living alone, being hospitalized with a flare-up, and impaired physical function. All these can increase the likelihood that someone with COPD can become more depressed or anxious. COPD flare-ups and exacerbations. Individuals with COPD may also have periods of time where their symptoms seem to grow increasingly worse. Healthline explains that this is called COPD exacerbation, sometimes referred to simply as a flare-up. In addition to damaging lungs, these flare-ups can be deadly. When it's harder to breathe, the body isn't able to adequately expel carbon dioxide, and a buildup of this particular gas can ultimately take your life. That's why it's also so important to watch for things that can limit your carbon dioxide exhalation. This also includes recognizing fast and shallow breathing patterns, shortness of breath, being overly tired or confused, increased mucus production, and experiencing more wheezing than usual. These are all potential signs of an exacerbation and are reason to seek immediate medical care.